Do you know that people can have heart attack without having any symptoms? Yes, that is true. And so on today's episode, dive with me as we talk about the silent killer heart attack and some of the symptoms that you should be aware of, and so that your timely recognition will save your life or the life of your loved one. Now, the statistics shows that over 805,000 people have heart attack every single year in the United States. In fact, that means that one heart attack in every 40 seconds. That is a very staggering number. And so recognizing the typical symptoms and atypical symptoms is going to help you and your loved one survive a heart attack. The most typical symptoms that people experience are chest pain, which could be a stabbing pain, a crushing pain, or it could be just a squeezing pain or a pressure or the sensation like somebody sat on an elephant sat on my chest. People may have those symptoms, and the pain is usually not localized. It is broad and it can radiate to your left arm, to your jaw, to your back, or even just to your throat. People can have those symptoms. And sometimes it can be associated with nausea, vomiting, lightheadedness, shortness of breath, or just people having palpitations. So those can be some of the symptoms that people experience with having a heart attack. And those are very, very typical symptoms. Now, sometimes people may even have vomiting. Okay. Now, there are atypical symptoms that is not very typical, and usually people who are diabetics, the elderly, women usually will have atypical symptoms. And if you do not recognize it, you may end up having a very fatal outcome. And the most atypical symptoms that women experience, they may have just dyspnea or shortness of breath chest pain, without chest pain, or they may just have unusual fatigue, and you just don't know what is happening to you. You're just fatigue or just weakness. You feel so weak. That could just be the presentation, or just indigestion or heartburn. In fact, I know of a physician who had heartburn, and he thought it was just a heartburn. And before he realized, he had a very fatal myocardial infarction. In fact, they have to rush him and put a stent in his heart. So sometimes just indigestion could be a sign of having a heart attack. What about epigastric discomfort that is above your diaphragm, below your diaphragm? People can have epigastric discomfort, or people can just have nausea, or just vomiting, or passing out, or just your heart beating very fast. In fact, I was on a ward one day, and one of our patients who is a diabetic and was having just nausea and vomiting, and everybody was started thinking that this woman was having a GI problem. So they gave her medication to stop the nausea and vomiting. And then when we realized that she was a diabetic, we decided to do an EKG, and she had no chest pain, she had no shortness of breath, and we did an EKG, and lo and behold, she had what we call an ST elevation MI. So there is an MI involving one of the big arteries, and timely recognition saved this woman's life. And so it's very important that you recognize these signs, because by knowing the signs, you can save somebody's life. In fact, there is a mnemonic actually that they use. There's several mnemonics, but one of the simple one to remember is CHAPS, CHAPS. That means chest pressure or chest pain, or heavy sweating, people just sweating profusely, or just sensation of an anxiety. Okay, and the P stand for feeling pale, diaphoretic and pale, and the S stand for shortness of breath. So if you remember CHAPS, CHAPS, could be a mnemonic to remember when you're having the symptoms. You should call 911 immediately. The thing you should do immediately if you're in your home and having the symptoms, you're in your home and you have baby aspirin, take baby aspirin, chew 4 of those, and dial 911, because timely arrival in the ER will take you to the cath lab, will save your life. So I hope this has been very helpful to you. And if this information has been helpful, share with all your friends and come back here for a weekly tip. And don't forget to hit the like button and subscribe to our channel. Remember, 21st century, you are your own doctor. Until then, Dr. Moses, I'll see you next week.